Hey everybody, what's up? Physical therapist Dr. Ryan Whelton. So I have, anybody using my SI protocol knows it works about five to 7 weeks, usually 5, but sometimes 7, sometimes longer depending on the person or whatever. Interestingly, what I'm seeing in my clinic since all this craziness in the world began, I've been doing this years. I know exactly how long it's going to take. Anybody using my protocols knows the same thing, but I've been doing this years, and what I'm seeing is so many of my patients are, since all this craziness in the world started, their hips and their back is going into spasm all the time. They get upslips randomly during the rehab, like they get full-on back spasms left and right. So I'm scratching my head. I mean, they still get better. It just takes much longer, and it takes much longer because, you know, if your quadratus lumborum spasms, then you're going to pull yourself into an upslip, okay? If your back spasms, you're going to pull yourself into an outflare, you know? So now it's almost like I'm in a tug of war, but one side's pulling harder, you know? Where normally the side wasn't pulling that hard and I could just strengthen the muscles I needed to do to reposition the pelvis. So it's interesting. I have a few patients right now that just keep going into spasms, you know? And the common denominator is stress. And a lot of them know it too. I mean, I talked to some of my patients about it and they're like, yeah, that's it, I know. And it's really remarkable because most people don't know that. I've always had a very hard time talking to my patients about stress because they get the wrong idea. They say, they think I'm saying it's in their head. It's not. I'm saying that when I get stressed out, my neck hurts, you know, I get tension in my neck. But if you get tension in your back, you're going to have an upslip, you're going to have an outflare, right? So anyways, so people are throwing their backs out left and right on me here. It's really kind of changed the game for me in terms of like my time frames. You know, I used to be able to say 5 to 7 weeks. Now most get better in 5 to 7 weeks, but now I'm having more outliers. Like instead of having one every 4 or 5 months that didn't, it's like, you know, 2 or 3 at a time I'm having right now. And they're all under severe stress, you know? So anyways, it's something to look out for. What I'm doing is I'm trying to get my patients to get the Fisher-Wallace device. That'll help with their muscle tension. And then you got to strengthen twice as much. Most of them won't meditate. You ask them to meditate, they won't do it. But by and large, I've only had like a handful over the years do it. So anyways, just keep that in mind that as stress increases in people's lives, that the water is muddy, you know, like it's not clear how it's like, oh, this will, you know, definitely get better in 5 to 7 weeks. All my other patients used to. No. You could have flare-ups along the way and it kind of gets bumpy, you know, they still get better, but it's just bumpy. All right. Peace.